Hey everybody, Dr. Schultz with the Centeno-Schultz Clinic. Happy New Year. Welcome to 2024. We're continuing our series on thoracic spine, and this is a short presentation in which we're going to talk about the 9 major causes of back rib pain. So thanks for checking in, and let's get started. The goals of this brief presentation include what in the world is back rib pain, some basic anatomy, and then to identify the 9 major causes of back rib pain. So let's get started. So back rib pain is that kind of diffuse pain on the mid-back, level below the neck and above the lumbar spine, and it can just eat you alive. It can be unbelievably dysfunctional and cause you to stay on the sidelines. So let's take a deeper dive and find out what's the major causes. Now that thoracic spine, as I mentioned, is below the neck and above the low back. It's right here. And then this is a very brief skeletal depiction of the thoracic spine, and it's a very complex area with lots of things that are specifically unique to the thoracic spine. And it includes the ribs as they come in to the spine at each level, and they create a joint here called the costotransverse joint. In addition, there's lots of muscles that support it. So let's take a brief overview of what are the major causes of back rib pain. Number 1, of course, a rib injury. Ribs are those things that come across. There's 12, and they articulate in the back as well as in the front. Ribs, any athlete will know, are susceptible to injury, which include a bruising, dislocation, or fracture. Number 2, costochondritis, just a fancy term for inflammation of the cartilage that joins the rib to the sternum. This can be very, very painful when it gets inflamed. Number 3, a thoracic joint injury. That's right. And there's 3 joints that are very important in the thoracic spine. They include the thoracic facet joint, the costotransverse joint, and the costovertebral joint. And these have been covered in previous videos. The next one is a thoracic disc injury. That's right. The low back has a discs, as does the neck. Well, that can occur, an injury to this can occur in the thoracic spine. Now, a disc is that shock absorber that is sandwiched in between those bony building blocks called the vertebral bodies. And they have an incredibly important role acting as a shock absorber. Unfortunately, they're susceptible to injury and degeneration, and they can actually cause back rib pain. The next one is a muscle injury. As you can see by this illustration, the back is rich in lots of different muscles. They're typically categorized in 3 different levels, and these muscles can be injured. They can have inflammation, they can have tears, and both of which can give rise to that back rib pain. So always think about a muscle injury. The next one is a ligament injury. Ligaments are those thick pieces of connective tissue that connect bone to bone. And doing so, they provide critical instability. So some patients have trauma and they have injury to those ligaments, giving rise to back rib pain. And you can see in this illustration the different layers in the thoracic spine. This is a side view. This is a spinous process. And what I've depicted here is the supra and interspinous ligament, both of which can be injured. In addition, you can have an infection. The most common infection in the thoracic spine is shingles, which is actually a virus which causes significant inflammation to the nerve and to the skin. And it usually gives rise to a constellation of blisters that are along the path of the nerve. It can be extremely painful and a cause of back rib pain. Another cause is organ dysfunction. Well, the rib cage, the thoracic cavity, as you know, contains lots of critical structures, which include the lung, the heart, the liver, the pancreas, and the kidneys. And all these can be injured or inflamed or damaged, giving rise to that thoracic pain. So always consider this as a possible source, particularly if you've had significant trauma. And then finally, posture. This screen time, either on your iPhone or your computer in 2024, leads to an enormous amount of poor posture and leaning forward, which can wreak havoc on your thoracic spine, giving rise to pain. If you or a loved one are being sidelined by thoracic pain, particularly back rib pain, consider an evaluation at the Centeno-Schultz Clinic. We are experts in the evaluation and management of thoracic pain. You will have the opportunity to be evaluated by a board-certified, fellowship-trained physician. You can either do that via telemedicine or in office, at which time we will determine your candidacy for different treatments. And remember, not all PRP and not all bone marrow concentrate treatments are the same. I hope this was helpful. Happy 2024. We'll see you next week.